Hello, and welcome to this episode of Community Voices Uganda on Civic Space TV. I am Philip Melissa. On this episode, we are having a conversation that speaks to individual but also national health, and certainly having a focus on a very deadly disease that befell this world and certainly this country, Uganda, in the name of HIV AIDS, and I have a very knowledgeable panel, expert panel of medical personnel and a journalist here that are going to help me understand what HIV AIDS is, but also going forward looking into why, despite decades of progress in the fight against this disease in the country, we are seeing a very sharp rise in HIV cases in this beautiful country, Uganda, and certainly they will help me understand why we are looking at this rise, where it's coming from, how it can be tamed, and certainly maybe why some of the efforts that have been employed by government and all other sister partners agencies have failed to curb this challenge in this beautiful country, Uganda. And before we get into that whole scheme of conversation, I will first afford an opportunity to my panelists to say hello to you, and we get into the depth of the conversation. I'll start with you, Dr. Oriba Dan Langoya. Doctor, greetings. You welcome to the conversation. If you can unmute and say hello to us.
Thank you. Thank you very much, Philip. Thank you very much, Ronald, for organizing this important presentation and a very important topic that everyone is, waiting to hear what is on ground. My name is Dr. Oribadan Langoya. I'm a physician under Ministry of Health attached to St. Mary's Hospital, Acho. I'm also head of Department Internal Medicine at St. Mary's Hospital, Acho, and also an honorary lecturer at Gulu University. I'm really very honored to be here and have this discussion with you all. Thank you.
Thank you so much, Dr. Oriba. We're so much happy to have you here, and we can't wait to hear what you will share with us from your knowledge as a medical doctor, and certainly regarding to this problem of HIV. I also have Nicholas Musinguzi Jr., doctor. Nicholas, greetings. Welcome to the conversation.
Thank you very much. Are you able to hear me?
Yes, I can hear you.
Yes, I am Nicholas Musinguzi Jr. and given the introduction of the previous doctor, I'm a junior in name and junior in practice. I work in Fort Portal with an NGO. I'm a neurospecialist committed to supporting children with neurological challenges, with expertise in understanding and managing various neurological conditions. And I work closely with children and their families to improve their development, well-being, and quality of life through compassionate care and tailored interventions. I've not worked mainly in an HIV specialty aspect, but I've met a lot of patients and a lot of children who have HIV-related complications that affect their neurological part of the body, and that's what I'm dealing with. Thank you.
Thank you so much, Dr. Musinguzi, a neurospecialist, and please don't be intimidated by the CV of Dr. Riba here. Yeah, the man has been around for some time.
No, mine is very short, Philip.
Yes, thank you. I also have here a journalist and who often specializes in health reporting, and that is Good Luck Jonathan. Good luck, Ronald Musinguzi. Good luck, greetings. Welcome to the conversation.
Good morning, Philip. Thank you for the opportunity. I'm glad to be with Dr. Dan on the show. He brings a lot of expertise and he's doing so much in northern Uganda and here even in Kampala and the whole country. So this topic is the statistics which came out, I think this week or the other one, a bit worrying. And I really am glad to be part with the doctors to hear what they say and maybe also what I say out there. Thank you very much.
Yes, thank you. Good luck. And you speak statistics. A lot has been said, and but something that comes out so critically is the fact that over the years, Uganda was praised for having managed well this HIV crisis through the late 90s and the early 2000s. We had very many success stories, and indeed, government was doing a commendable job in trying to make sure they kept this challenge and passing out the message. At a certain point, the message was made a part of the curriculum in primary school, and we all had the messages running on radios. We had the messages on billboards across the roads and the streets everywhere. And people were saying Uganda is doing tremendously well, and there was a decline. And Dr. Riba, I want to start with you here as you help us understand this crisis of HIV/AIDS. What is the reason for this change of trend now that people that were talking about a decline are now talking about an increase? What is the reason for all this? And certainly you will help us understand what this HIV is and what it actually affects and why we should be worried about this particular disease. Yes, Dr. Riba.
Thank you very much, Ronald, again for this opportunity. HIV is something that I think is not a new disease and has been in existence for long. And pretty much very many people, including children, are aware of HIV and its modes of spread. The most important thing is that we have to appreciate that this is a virus that takes a toll on someone's life if they have got it throughout their lifetime, because currently we don't have a cure. Initially in the pre-ART era, pre-ART mean before the antiretroviral therapy, there has been so many strides of HIV death. And of course, there has been a lot of, education at school in terms of, abstinence, prevention and use of condoms. The ABC approach really has been preached all over. But of course, we also see that over time, the ABC approach has gone down. Much as, children were not, the curriculum in school has not really stretched this so much. But also we see a rise of, very good innovation in science, whereby you have new drugs coming in and for management of HIV, for controlling the viral load. And then at the same time, you also have, innovations in terms of, teaching people on condom use, which never used to happen. So the distribution of condoms throughout the country, in hotels and in hard-to-reach areas, has also made sure that, the spread of HIV itself comes down. But to mention specifically that, in the mother population, because I mean, these are the most important people in our lives. Mothers face significant challenges in terms of HIV spread, and they can also be the propagators of spread to other people, especially children. So I think our Ministry of Health and its partners has strengthened a lot antenatal care in such a way that we used to have antenatal care about 2 or 4 visits in the past, but now there are over 8 antenatal visits. And in all these antenatal visits, people are encouraged to come with their partners, and testing is done. I mean, you have an HIV test done, and you are started on medications. Again, I contrast this to the pre-ART era. In the pre-ART era, we used to have a cutoff of viral load of 350. No, not viral load, CD4 count of 350 for someone to be started on HIV medications. So it's like literally we are waiting for someone to develop complications. Then we start saying, okay, now let us put you on medications. But, you know, this trend has been growing, and I think government and its partners, especially USAID and PEPFAR, has helped avail ARV medications to the people who never used to have access to these medications, so that now we have what we call treat and test, test and treat rather, approach, whereby you come to the hospital, they find you are HIV positive, you're HIV naive, then you are started on treatment. So this is how far we have gone. And so it has eliminated so many other conditions that I don't know if you want me to talk about it now, but
Yes, Doctor, thank you so much. And you give us really a good understanding of this, but also the evolution of this challenge,
yeah.
starting from way back. And you use a couple of technical things there, including the pre-act era. And certainly later we shall continue understanding more of that as we proceed with the conversation. But I want to hear from you. Good luck. Look, you saw the statistics, and one of the things that come out is it is on the rise, unlike in the past, in the youth, people between the ages 15 to 29. And I want to understand, as a journalist, when you're moving through the communities and picking this information, what are you hearing? What is the reason for this rise? And certainly, why are the youth now a very viable demography for this particular crisis?
Thank you very much. It's very sad for us as a country. There's what normally people say, that when you lower the guard, that when you are holding the guard is that you have gotten the information, or you are doing something and you are alert, that. But when you relax a little bit, and from what Dr. Dan has said, maybe because of some advancements in science, people no longer take HIV/AIDS as a serious disease. But this is showing that we have lowered the guard, we are losing the fight, and this is very bad. So recently I was in Jinja and I talked to a group of sex workers and I was in the place where they work from, and you could see that there is a problem, for me especially, how men handle health issues. That some women were saying that some men will come and say, me, I don't want to use a condom. But because this lady wants some money, and of course, even the money they were talking about was 2,000, 5,000. That one also talks of the poverty levels. This week, which is going to end, I had an opportunity to attend an interministerial meeting with 4 ministries: local government, gender, health, and education. And this is the same topic that came. And they were talking of, it mainly was focusing on adolescents, both in school and out of school. And so they were trying to see how they can leverage on, for example, PDM, the organization that has been put on at the level of parish, to see how they can tackle issues of poverty. But then we have also governance issues. But then we have also legal or gyros, where we have, for example, who are these people who, for example, are spreading some of these things. And we heard of voices where that there are some leaders, for example, let me say, if a chairman LC3 is involved in a case of either rape or either, funny behaviors, that he's known in the area, that no skirt passes by him, what really happens? And so the discussion is on, and I'm told around October, the First Lady is going to come up strongly and lead something which will be communicated by the offices concerned. So what is true is that the talk these days is either too much of the politics, too much of what, too much of football. And I'm happy that Civic Space TV, you have come out to say, let's put this on the agenda, that we cannot keep quiet. You remember when COVID came, everybody, the president was on TV. You remember words like Okwesiamula, things that were a bit funny, but we were able to contain this. Now, for me, to the doctors, to the political leaders, I was talking to Dr. Dan in the morning, and I'm wondering, for me, what are politicians talking about in these elections? I am, unfortunately, I'm not following so much of what they are saying, but I imagine if they were talking about this, can they add their voice? In the churches, I mean, Philip, you saw what is happening in the region where I come from. Now, churches have also taken to politics. Everybody to politics. But while politics is good, but it does it. So that is how we have lost this. And I can say, as I conclude, that at the level of government, that there is concern because data moves the debates and maybe resource allocation. Thank you very much.
Yes, thank you so much, Ronald, for that. And actually, what you say is very worrying, including the scenario you referred to that you did observe in Ginger. And I guess those are some of the things that should be critically looked into and addressed. And Dr. Msimbuzi, if I hear from you, and you did mention in your introduction that you deal a lot with children, young people, and I want to understand when HIV is in the presence of these young people, the infants, newborns, and age 10, 12, below 10. First of all, how is the care managed at that level? But two, what kind of life and certain, because these are people that are still very young, they can't do a lot of things for themselves. How is it done to make sure, one, those that are already victims have a decent life, they can live, they can survive, they can see their future, but also those that are not yet born, what kind of care is given to make sure it is prevented from happening to them? Yes, Nicholas.
Thank you very much, Philip. I don't know whether you were getting me.
Can hear.
Yes, the Ministry of Health has done a lot to make sure it prevents the transmission of HIV from the mother to the unborn babies. As Dr. Dan has highlighted, the emphasis on antenatal care and mothers with HIV going for antenatal services, there is a lot of emphasis on prevention of that transmission to the unborn babies, as well as at the time of birth, mainly at the time of birth, because you expect the virus to be transmitted mostly during the birth process, that second stage of labor. So we have had most of the cases, most of the new infections at adolescent stage, not at birth. So I would like to concentrate on the adolescent stage and also hit on a few points that some of the speakers have talked about. We have seen a high complacency of the HIV threat in Uganda. There is a lot of what you can call people no longer fear the disease. People engage more in risky sexual behavior at a young age with less or no protection. So we have not seen a lot of cases in a lot of cases at birth, but more cases are within the adolescent active stages. I don't know whether I'm answering your question.
Mm-hmm.
And then what drives the increase? I would like to point out three factors: complacency about the HIV threat, and then also poor treatment adherence and retention among the few people with the HIV infection. And then also reduced prevention funding. Most of the funding concentrates on the art part of it, but there is less funding on the prevention part. And we are, hello?
Yes, Nicholas, I can hear you, but I wanted you also to tell me, because you keep mentioning the complacency, and I keep asking myself, Uganda currently boasts that about 90% of the population has at least gone to school, and I would expect that whoever goes to school and at least crosses primary 5 knows a bit about HIV. Why would anyone wake up and say they are okay and they no longer fear disease that, like Dr. Riba told us, does not have a cure as yet? Why would anyone get into such a situation?
There is having knowledge and there's having the will to act. Like the gentleman, Dr. Msinguzi told you, there is a tendency of men to engage in unprotected sex with sex workers, not because they don't have the knowledge of getting an infection, maybe an STI or any other STI or HIV, but there is I don't know how to call it, but there is a reduced will of people to protect themselves from, most especially these adolescent, the adolescents and the young people.
Yes, thank you, Nicholas, for that. And it is important you mentioned that. And Dr. Riba, I want to get back to you. You see, I have had this so-called prevention, but let's discuss efficiency. How effective are these prevention measures? And earlier you mentioned the use of condoms, and yeah, sometimes they talk about the different medicines people keep taking, that if you take this, then you cannot get HIV, or even when you get it and you take this in a particular period of time, then it will cease to affect you. And so many, how effective, first of all, what are some of the measures that are there more on preventive, but two, how effective are they going forward in making sure this does not continue spreading at the rate we witness today?
Thank you very much, Phillips. That's an important question, and I think it forms the basis of our discussion. In prevention, a lot of striders also happen in terms of prevention. I will start from the mothers coming onwards. As I told you, HIV is also transmitted mother to child. Those days when we were still in medical school, 2011 and the rest of it, we had what we call prevention of mother-to-child transmission. Means you get these people earlier on, you monitor them through antenatal care. Once the child is born, you start the child on nevirapine, okay? Now that is part of, nevirapine is an HIV medication. That is part of preventing mother-to-child transmission. Mother is infected, but you don't want the baby to get the infection. So you give the baby ARV medication to take, HIV medication to take upon birth. And you keep on testing their viral load. That is more of an expectant kind of management. And after that, World Health Organization came up and said, you know what, we don't have to wait for the baby to acquire it or to be at a very high risk, because HIV per se has a very high replication. It multiplies very fast during pregnancy. And so pregnant women are likely to give it to their children. They're likely to transmit it also to other partners, because pregnancy does not mean you are not going to have sex. So they said, okay, let us start a test and treat, and we go towards what we call elimination of mother-to-child transmission. And this has been a very strong hold, and up to now, we are actually still using what we call elimination. We want to eliminate mother-to-child transmission. Why? Identify these mothers who are HIV positive. After identifying them, start them on ART immediately, drastically reduce their viral load during pregnancy, so that what the UNAIDS is advocating for, now that, you know, the 95, 95, 95 goal, 95 on ARV, 95% viral load, 95 taking their medication very well, you will prevent HIV, because once their viral load is suppressed, they become untransmissible. So that becomes the basis of elimination of mother-to-child transmission during antenatal care. Of course, they also teach midwives and doctors cord care, because during cutting of the cord, you have to milk. No, you don't have to milk. You don't have to do a lot of maneuvers on that cord to prevent blood from the mother and the child mixing. So that is taught, and I think Ministry of Health and its partners has gone through extensively. All our midwives, me, I see all of them practice that on a daily basis, especially when I was still in Obs and Gyn. Now, going back on the prevention approaches, as I told you, when you have undetectable equals to untransmissible, means your viral load not being detectable because you're taking it every day, and you are virally suppressed, you cannot transmit that disease. So that's why we say we can eliminate HIV actually when we have very strong will, developmental partners' will, and the will of the people also, because the most important thing, the developmental partners and government can inject a lot of money in this thing. But when people are not taking their medications, it becomes useless, because these are the people who are supposed to be suppressed so that they don't transmit. Because, you know, our sexual networks have really, really increased because of change of our lifestyle. You know, people don't care like in the past. Now, going to the different methods, like condom use. Condom use, once you use it appropriately and it has not broken, it should be able to prevent you from HIV, you know, 100%. But if it is broken, then that is a problem. Then your risk can increase. The needle pricks and the rest of it, the risk is actually low on needle pricks, because now when you get, like me, I've pricked myself twice. When I was a medical student in 4th year, I was suturing a mother who was just delivered. I pricked myself because she had got a birth tear. The next one, I got a splash when I was doing an operation. But in all that, when you do the thing, hand washing, you know, we have emphasized hand washing. Wash your hands, wash the exposure site very well, dip it in alcohol, 95%. The transmission level goes very low, and you know, it's 0.14%, okay? But that percent becomes very significant if you are the one who acquires it, okay? So they said, okay, you have washed your hands very well, and you have reduced the risk of infection. Now you can take PrEP. PrEP is what we call, no, you can take PEP. PEP is post-exposure prophylaxis. We have HIV medications which can be used to prevent the virus from entering, because there is entering your body. You have introduced the virus. The virus needs a lymph node. A lymph node, there are small defense systems in your body for it to attach to that lymph node and multiply. So if you take the medications early on, like within 72 hours, the virus doesn't have that time to move. By the time it goes to the lymph node, it finds the medicine concentrated there. It cannot, because HIV medication are classified. There are those which prevent the virus from multiplying. There are those which stops the virus from getting its food, so it stops protein synthesis. There are those which prevent the virus from entering inside your cell and integrating itself to become part of your body. So if you amalgamate all those processes together, you find that the virus comes, finds everything is wall off. So it can't feed, it can't enter. So at the end of it all, if you can't do that, you can't stay inside that body. So naturally, it is eliminated. Okay, so you find that you take this medication for 28 days. Why? Because you want to make sure that there is no chances of any of those virus attaching, and you starve them. I mean, me, I always tell medical students, I starve them for 28 days. They can't survive, okay? If you are in that window period, which we say 72 hours. So that is the importance of post-exposure prophylaxis, okay? Now, post-exposure prophylaxis works very well, actually, if taken within 72 hours. Within 24 hours, you have around 99%. I can't say 100, you know, the percentage starts reducing with the increasing number of days and becomes obsolete after 72 hours. The risk of acquiring the infection increases because you have made the virus, might have attached to one of the lymph nodes and already started replicating. It will just wait for its time. When the 28 days is done, it hibernates and it reactivates itself. So we have to emphasize the importance of the window period. 72 hours is important, and it is research-based. Now, we go to another mode of prevention. Abstinence. I don't know why we are not talking about abstinence. Abstinence is 100% effective, but it's difficult, really. You know, when you have hormones fighting you, you have so many things on your back. The eyes are deceiving you, the ears are deceiving you. What the media, TV is showing you things which entices you, and you know the eyes, the eyes sends information to the brain, and the brain works upon it. So we have found out that in the era of TV, in the era of modernization, abstinence has become very low. Why? Because we have adopted Western culture. We now see people dress in very short skirts. You know, we now see so many things happening. You get, even cartoons now, they are kissing and the rest of it. So all the thing has really gone down. So we have to look at the social aspect of it. What has happened? You know, there is a demographic change. We used to have a lot of cultural respect and the rest of it. You know, nowadays it is going down because we have adopted so many other things. Me, that is what I think. Again, I may miss other aspect of prevention, but let me talk about pre-exposure prophylaxis. Now, Philip, this is very important because as Musinguzi has talked about and as Nicholas has talked about, we have what we call risk populations within our settings. Risk population are people who are shy, first of all, to show themselves in public. One of those that, you know, Uganda has come out clearly to say that we don't entertain homosexuality. Those are actually what we call our risk population. And they are few, they are the minority, okay? But they are there, and we have to talk about them. Now, another one are sex workers. Sex workers are unlikely to go and look for condoms. They are unlikely to go and get ARVs, okay? And normally their rights in terms of choosing which method to use is suppressed by the person who is paying them. And you see, Ronald put that clearly, that, you know, some men don't want to use condoms, and then some women actually, you know, they say they have refused, but they need the money to survive, which is the irony of that. So pre-exposure prophylaxis has come in, and we have gone through also the stages of pre-exposure prophylaxis. The pre-exposure prophylaxis started in what we call the discordant couple. Why is it that there are some people who are HIV positive and their partners are negative? Can we also prevent the partners from getting the HIV? Can we also study the partners and see what is special about them that they can't get HIV? Okay, so those are the things which comes, and then at the end of it all, you find that we have medication that the partner takes once they are meeting. That is one, and then we have also had medication that this patient, these sex workers can also take. Those who are negative, they can also take because that's their work, so that they don't acquire HIV. And so if they don't acquire, because they sleep with so many people, they can't spread. Now, another one which I think I'll say because of time, so I give space for other people. On prevention aspect of it, we also have, you know, the condom use. We have talked about it, and being faithful, you know, the marriage partners and the rest of it. But we still find out that actually a lot of challenges occurs in marriages, okay? So we still need to emphasize it the biblical way, to be faithful. In terms of prevention, again, we look at safe male circumcision. Let us be sincere that women are at higher risk of HIV than men. They can easily get the infection than men. Like you see the 2010 demographic statistics to 2023, we had 93,000 HIV positives. And then at the moment we have 38,000. So this is a very big improvement. on the part of Ministry of Health and government. Why? Because they have reduced it by over 30%, more than 30%. We had 98%, 93,000. Now it is 38,000. That's a very good stride. But what has happened? What has happened in that? There has been so many multiple prevention techniques, because if you circumcise men, HIV cannot attach, because we have the lymph nodes on the prepuce of a man. And so HIV are unlikely to attach there. And so they can't also spread it. And they can't get also abrasion. And it prevents HIV transmission by about 60%. It's not 100, but 60 is quite good enough when you are looking at prevention. And they cannot get it from women easily to men. Yeah, so that is part of the prevention. Thank you very much. And I'm sorry for taking a lot of time.
Thank you, and we appreciate, because there is really good knowledge that you've shared with us, certainly, and I know the viewers are going to benefit a lot from this, including, for example, the very last example you give. It's a point of knowledge that many people have taken for granted over time. But good luck when I come to you. You see, Dr. Riba did mention the word will in here, and if I go back to the ministry, and we are speaking at a time when we now finally know that USAID has been completely closed, and that affects a bit of the funding that has been coming to our country to that particular respect. Speaking to the will, but also the capacity of the ministry, do you see the Ministry of Health that we have today being able to fully finance and manage this crisis that is unfolding in the country, and how do you see us moving to that direction? Yes, good luck.
Yeah, thank you very much, and thank you, Dan. I really also felt you should have continued speaking from the point of expertise. In terms of funding, the Parliament this year, which we have entered, that's 2025-2026, they increased the budget of Ministry of Health by 2 trillion. And therefore, I can see Uganda AIDS Commission was saying they had a shortage of 300 billion. So I think when you factor in the 2 trillion and all that, looks like we might not be in a danger zone. Government has tried to put some resources. My thinking is that in terms of who gives the money, it's not Ministry of Health. And if you host members of parliament, maybe in these other debates, you need to ask them, what are they doing to increase the budget of Ministry of Health? Because also when they go back, communities where they come, people face the same challenges. But when the Ministry of Health is not given money for recruiting doctors, money for buying medicines and all this, these guys they can't do anything, because they don't hold, per the constitution, what you give is what they. But I visited Mubende, and I don't know what's happening in Fort Portal and Lacho. I found that they have tried to, the services now go on. So for example, when people come to now pick the medicine, they have these other specialists who come and talk about them non-communicable diseases and these other things that they need to. So HIV management has sort of been included in the system of our healthcare system. So you might maybe these issues of stigmatization, how people see me when I come to OPD and all those things. And I think maybe as I was talking, Dr. Dan, health is a continuous, it's a continuous way of improving things. So I think as we, and of course also remember, as the United States is closing, I think I've heard Korea is going to give us some substantial money. The World Bank has come back on board. And so it's not, by the way, also the other good thing is that you said what the United States of America did, never took away the money. They have repurposed the money. somewhere, and I heard that, for example, much of the USAID money is going to train community health extension workers, who are going to be now helping, visiting families, talking about these things. So, according to the Abuja declaration, I think, which called for 15%, I think for me, even if they were to push to 10%, but the doctors know that if we were to help them add in insurance scheme, so that those of us who are able to contribute, because for me, I don't have a problem contributing, even if it was 100,000 of my yearly income to supporting health. I wouldn't have any problem, so that maybe we can subsidize for those who cannot. Now, for me, if we do that, and we know there is a bill that is coming, but most likely overtaken by events of elections. But after elections, Ministry of Health for the last 2 years has been pushing, saying that if you want us to really give some of these services, the people, we should stop, this business of saying that we can provide free things. Of course, I agree that when you go to a hospital, you find this consultant. For example, Dr. Dan, I don't know how much money you'd be paying if he was really to go around what you have heard him say, or Dr. Musinguzi. It would be a lot. So government subsidizes on that. But sometimes then you find the medicine aspect part of it. So for me, the next parliament that is coming, and that's what I was saying, that Melissa, Philip, you have a big you and everybody at Civic Space TV, Madri Nahiga, I see her hosting many people, that politicians, for once, let's put them to make a commitment, either in writing or by doing videos, so that, when they go there and they don't do these things, we hold them accountable. But funding, I think government, I have been privy of knowing that our leaders have been moving. Minister Acheng, Minister Honorable Jane Ruth Acheng was in Europe. Under the Uganda committed to pay $1 million US, and I could see that other European countries are coming in to bridge the gap. So it's we were shaken, but remember when we went through the bill for gay or something like that, I think we were already prepared, because the cuts came at that point, not until when you said. So by the time you said was cutting, for us, we had gone through. I don't know what other countries are going through, but I think something is being done. Thank you very much.
Thank you so much. Good luck for that. And that gives a bit of hope to the people that directly are at the mass of this service, but also every other member of the population, because actually everyone is at risk of being a victim of HIV stroke AIDS. And Nicholas, you see, one of the things Doctor mentioned here, and I think you yourself was the groups of people that are highly at risk. And when you look at, for example, the data that was released recently, they are talking about the youth and the women, but also you saw the difference in, you have very many women with this disease and fewer men, and things to do with that. I want to understand from you, and earlier you mentioned that the men are shy, and I think it will go even to the youth. They are also shy in, first of all, going out to test, but also even when they test, disclosing to their partners and colleagues that they are in that situation. How do we motivate, inspire, first of all, every member of the population to be concerned about their HIV status, but two, making them open up about it? And good luck here mentioned about stigma earlier, making them open up so that we save the other part of the population that is still okay. How do we get in that direction? Yes, Nicholas.
Yes, thank you very much for the question. And given that I'm a public health student at Bugema University, when it comes to health advocacy, that is something I'm interested in. I'm someone who has worked in the fishing communities in Kasese, and when doctor was talking about the groups that are affected, he forgot the fishing communities. And from my experience with these fishing communities, I was in Katweka Batoro, where I did a lot of work with those communities but it was mainly related to promoting awareness about cerebral palsy in young children and changing their perception about cerebral palsy, not mainly about HIV, but I had a glimpse of their ideas and concepts about the about HIV. And the youth and the young women in these fishing communities uh, face a lot of burdens from the falling, what you can call the broken family structures in those communities. They are less likely to get advice from 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 people close to them because they have broken families, and they are less likely to share their sexual lives, uh, their sexual encounters with people who can restrain them. So coming back to your question, how can we motivate the youth to open up, to 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 go for treatment, to go for these PEP and PrEP services? I think a lot of education has been done, but as doctor has highlighted, the education is mainly done in media platforms, but we have had little or no emphasis in schools, and we have a lot of population. A lot of our population is in schools, and most of them, instead of accessing these mainstream media platforms, they access social media. And if you see what is on social media, the highest good that is sold on social media is pornography. And in most of these pornographic scenes, there is less or no use of condom. And you can imagine a young child, most of the things they experience are in that area where little or no protective methods are used when uh, when people are going through sexual activity, and they have little or no interface with the mainstream media, because most of the adverts are put on NBS and UBC, on MTV, and there are very few youth that watch NTV, but there are many youth that are on Twitter, many youth on Facebook, and we have seen little or no effort to 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 sensitize the youth on the platforms that appeal to them. So we need to have more sensitization in corners where the youth are, not in the mainstream media only, but we need to narrow down and concentrate in the corners where the youth are. And we also need to go to these fishing communities, because when you look at the statistics, it is women first, women and young children, then sex workers, and then the fishing communities. And as someone who has had an experience with these fishing communities, in most especially in Katweka Batoro, I can tell you these people have the information, but then there needs to be more sensitization to cut out the myth, because these people have the information, but there is what we call cognitive dissonance. They have the information from the Ministry of Health, but they have a lot of deep-seated myths about the information and about HIV. Most of them don't want to use condoms because maybe they say sex without condoms is not sweet. So putting that in quotes, sweet in quotes. So when you look at that, you have the information, but it is not all about giving the information to people. It is also about changing their attitudes. And you don't change attitudes of people by giving them information. You have to listen to them. You have to understand their myths, their cultures. So then, one, there needs to be a lot of information given to the youth directly in the corners that appeal to them. And also there needs to be a lot of concentration on attitude change, not just giving information, but attitude change in these affected groups, most especially the fishing communities. Thank you.
All right, thank you so much, Dr. Musingu's there. And Dr. Riba, when I come back to you, earlier you mentioned, you talked about the situation where you find a partner, one partner is positive and the other is negative, and that took me to, when you come to the spiritual sector of society, they will tell you that is a miracle that happened. And where am I heading? In our community, I want us to discuss quote unquote treatment or management of HIV, and what is the best practice management of HIV victims currently in society? Because apart from some spiritual leaders saying they can pray and HIV disappears, we have very many doctors that, or people that call themselves doctors, that have brought a lot of medicine on the market, and they say this will cure you of HIV. Herbs, there are very many on the market, but also you will hear, when you go, for example, on the internet, you hear that country so and so has discovered a medicine. I think there's also a medicine that was unveiled recently that involves Ugandan scientists that is about still HIV. I want you to bring us to speed. What is the most recent update about the treatment of HIV, and for victims out there, how best can they manage their lives to make sure they can continue to survive, and but also not endanger the lives of others? Yes, Doctor.
Thank you, Philip. I won't go much into history again so that I can save my time. Thank you. The current treatment for HIV is a antiretroviral medications. That is, we have tablets and which are available for treatment of HIV. But that is not the major thing. That is not like the only thing. People who are HIV positive go through a series of tests to make sure that the medications that they are taking is actually working for them. So one of the most important things is there are what we call first-line medications that are available. When you take it and it's not working on you, they can go to second-line treatment. If you take that one and it's not working for you, by the time they change you to third line, they do what we call viral resistance testing. They take the medication, then they go and test you that which medication works better for the HIV that you have, okay? Because there are some which are resisting that the medicine that you have started on. But normally that comes when someone has not been taking their art very well. You take today, you don't take on time, and the rest of it. So the virus developed resistance, and the drug which was working for you does not work. So they now have to change you to another medication. But before that, you go through so many things of what we call adherence counseling. They tell you, you have to take your medication on time, you have to eat well, and then you have to come back and we test your viral load. Initially, we used to do what we call CD4 count. CD4 count is the measure of the lymph nodes which fight the HIV disease. So HIV destroys the CD4 count, the CD4s, so much that once the CD4s are so down, you are at risk of other infections, okay? So we now use both CD4 count and also viral load. When someone takes their ART very well, we take their viral load at the beginning of treatment, at initiation of treatment. We know your viral load. Then when you come back after 6 months, we again do your viral load. And so this one takes us back to the importance of partners, Philip. Viral load is very expensive. And to be sincere, Ronald, you have put it clearly, they have increased the budget of Ministry of Health through domestic funding. But if I would still, advocate, I would advocate that developmental partners should still prioritize this. They should prioritize increasing funding to make sure that people who are on HIV medications get their medications on time, that they get their medication and they go through the testing as well. They are tested through viral load, through CD4 count to make sure that they are suppressed. Because otherwise, we will be doing blindly. And we have already seen that much as the funding cut has been there, some of the services have been disrupted because for us in Lacho, we do what we call moonlight testing. We used to go to, in the evening to, specific corners of the place, specific corners. I think, Philip, Ronald, corners around your area which are risky. So these are people who don't come to the hospital. So those ones who are positive, we secretly go and give them ARV medications. You take their baseline testing. But through funds cuts, believe me, this has become difficult because hospitals cannot sustain, visiting these facilities. So they need to re-envision how they are going to how they are going to continue the HIV care cascade. Otherwise, we risk going backwards in terms of reinfection, and we have already started seeing it. By 2030 or by 2029, we might have lost the battle of suppression of HIV in this country if we don't reimagine the care of following up these people. Now, they claim that I have treatment for HIV. I really don't want to go into the other aspects of medicine. Well, that's really very political and the rest of it. But believe me, Philip, no one should tell anyone in this world or in this part of the country that they have the medicine that cures HIV. It's wrong. And it misleads the population. Even those who are religious, I think they should be cognizant of that they shouldn't mislead the public. Instead, they should advise the public that you are HIV positive, continue taking your medication. Once you take your medication, you become virally suppressed. When you are virally suppressed, believe me, you can't transmit it. Okay? You can't transmit it because the viral load is not detectable. But does not mean that you don't have HIV. You have the HIV hidden there. And some research, which I don't want to preempt, okay, the people postulate that probably one day we shall get a cure through DNA research and the rest of it. But for now, we don't. And this recent medication that is there, believe me, has gone through stages. We had one whereby you inject monthly, okay? You inject monthly, it was there, they tested it, they improved it, now they have a newer version, which is 6 months. Okay, it was tested in Ugandan population for prevention of HIV, not for cure. Okay, so they give it for high-risk population. People inject themselves 6 months, and they measured their propensity of getting HIV, and they found those who have actually got the injections did not at all get the infection. So the medicine was very effective, but that is not a cure. It helps you, like I told you, it is like PrEP. It prevents the virus from accessing your immune system. So the virus cannot survive. So it's not a cure. Again, it is very expensive. So this should not be like a leeway for people to just be running around thinking that, okay, now everything is fine. The thing is very expensive and the pattern is still protected. Until the pattern is released, they negotiate at international community. They bring this treatment and other manufacturers start bringing it on board at cheaper cost so that government can procure it and give it to the risky population. Of course, not to everyone. Then we still need to follow up. Take your medications very well. If you're HIV positive and you take your medication very well, you are supposed to continue following up also on your care, and to make sure that you don't transmit the HIV to anyone. I am really very happy, and I have to still reattest that there is still no cure for HIV, but I think one day, of course, with the improvement in funding, it will be God, and of course, in improvement of science, it will be God. Thank you very much.
Thank you so much, Dr. Riba. And the most important point there is there is not yet a cure for HIV/AIDS. And to you all our viewers, we thank you for keeping it Community Voices and Civic Space TV. And that is the most important message, because very many people have been sold to different kinds of drugs, medicines, and those are not things that are helping you, but are creating trouble for you. Our colleagues, we are nearing the end of our conversation today. I think we have about 8 minutes to be out of here, but quickly, good luck. You see, earlier Nicholas here and Oriba threw some jabs at the media, and They said one of the reasons people get so excited in the public is because of what you and I are putting out for consumption on our TVs, on our radio stations, in the newspapers, on social media. And I want to hear from you. And we know growing up, we were taught that information is power, but now we know that power has shifted from the information but to the ability to share that information. When you look at the media space today and going forward, how do you think the media can play a significant role in trying to curb this crisis that is unfolding in the country? Yes, good luck.
Thank you very much. I worry a little bit because the media is too much of commercialized. It's about creating conflict in politics and all that. Then somebody tells you that what sells is the conflict, and then we forget about the social fabric building Uganda, not knowing that when you have a health population and maybe they boom even economically, you get the money. So for me, my problem is that maybe the media need to be trained, or maybe government also needs to put as a way of licensing, needs to put a certain percentage of programming to be rerouted to some of these things. For example, it's like when there's what they call sin tax, where they will put tax on alcohol, tax on cigarettes, so that they fund some of these other problems. So I think also the media needs to want to be engaged. But for me, it's like quite a lot has been done. Even if we were to talk until the day ends, a lot has been done. I think now we just need to start saying, where do we fix? And so for me, is that the media, in terms of programming and licensing, they need now to be told the next time you come to get your license, either maybe 50% is much, but maybe 30% of your programming should focus on this. Today, I just seen the numbers from social media. 9 million Ugandans, close to 10 million Ugandans are using TikTok. 10 also close to 10 million Ugandan people are using WhatsApp. Now, what is interesting is that X has 1.3, Snapchat and this other one, what has also less than 2 million. So I think really somebody needs to come in and guide. But for me, from internally, the way I know the media is working, it's like the media has resigned. It is no longer, doctor can give us a picture of what is happening in northern Uganda. But for me, I see the media people, if there is a rally across a hospital and Dr. Dan and Musingus are holding meeting, I doubt if they can get even a single journalist to come and cover them. And there's even the media, there's what you can call media ignorance about some of these factors, these things we are talking about. Sometimes I go up country and maybe the media has opportunity to ask questions, and you feel that there's quite a lot of ignorance. And therefore, how do we teach them? How do we do what? But for me, engaging the culture, for example, here in Uganda, when the Katikiro comes in and joins, you know, the Kabaka is the UN AIDS ambassador, goodwill ambassador. We have now seen the Chabazinga join in the north and in the other places where the cultural leaders are still respected. I think they need to be put on board. But for me, the politics, so the media really should, when you give us a story on whoever is going to be a leader and what, also give us the other side. So if we don't do that, I don't see us going. When they talk to me, I've stopped watching TV. You hear this music, you see people are just put on, they are naked, and you don't even understand what they are saying. They are like pulling. Actually, even when you look at the advertisement, there are these funny drinks which cost 1,000 that they give you power. So when you see here, the advertisement is saying they are giving me power. Power to do what? Music, I'm seeing naked people. So the other side of the prevention of saying let's not do this, zero. So you can see the media actually, I don't want to say they are enemies, but partly what they are pushing because of the money, they don't know they are 90% could be the reason of why we are seeing the young people. Just see Dr. Dan and maybe Muslims and any other person out there watching us. Ask them when you put a post on some of these things on health issues, how many people will follow. But let somebody put a video of a naked girl. You hear everybody share the video, share the video. The thing is going in. So for me, there is a problem with our setup, but the media, if they continue putting these adverts, and some of these adverts are very dangerous, because how do you say a drink is giving you power? Power to do what? Then you find young children are also looking for.
All right. Uh, all right. Thank you. Good luck for that. Thank you. Unfortunately, because of time, I need to move to the other two speakers to give their final remarks. But I know you raise a very important recommendations there, including to attach some requirement on the licensing. I know very many activists of freedom of the press will say otherwise. So that is an infringement, but those are very important issues you raise, and a couple of other products that are out there on the market. And certainly we see how some of these can be incorporated in the system. Dr. Msingles, I want to hear from you by way of giving your final remarks. The kind of advice you would give, I understand you said you're very, you still in the youthful bracket. What advice do you give to the youth out there as regards this particular crisis, and certainly on the line of prevention?
Yeah, thank you very much, Mr. Phil. Before I go to the advice of the youth, I want to talk about the issue of the media. Just one second. I spent 2 years in Kasese, Fort Portal, Toroko, Bundubujo region doing advocacy for epilepsy and cerebral palsy, these neuro challenges, neuropathies and encephalitis. But we had a very good team of neurologists from UK, we had one from India, and neuro specialists here in Uganda, but we didn't get any media coverage. We tried to buy airtime here and there, and we're not getting the coverage. And it's a challenge in health advocacy, the compliance of the media, I would want to say. And given that I'm a student of Masters of Public Health, uh, public health is important, and changing the attitudes of people is also important. And if the media does not take initiative to change the attitudes of people, we shall keep having such challenges. To the youth of Uganda, I would like to advise them to open up, to find people they can trust, and share with them the challenges they meet, be it challenges in their sexual health, even their decisions. Before they engage in sexual activity, let them share with someone who is old, maybe a mentor or a family member, who can guide them on the best practices to do, and most preferably someone who understands how to prevent HIV. And people like Dr. Dan, they need to approach people like Dr. Dan. They need to approach people of advanced age who have gone through similar challenges, or who have gone through similar experiences, to guide them, to counsel them. It's all about it's a two-way thing. The elders need to be in it as well as the young people, but the young people need to take the steps. They need to take the first steps to approach the elders for guidance and medical personnel. Thank you.
Yeah, thank you so much, Dr. Msingus. And lastly, Dr. Riba, as we get out of here, what message do you put out there for the people, the ministry, in terms of us responding to this worrying trend and making sure we can reverse it to get to good figures that are sustainable, but also eliminating this very dangerous crisis? Yes, Doctor.
Thank you, Philip. In my last comment, I will divide it into three. One, to my fellow youth and to the people in this country. HIV is still very serious and it's very common. We need to go back to the basics of prevention of HIV. And for those who are positive, I encourage them to continue taking their medications so that they are virally suppressed and they don't transmit the infections to other people. Again, I come to government as Ministry of Health. I think we need to continue advocacy for people living with HIV so that within this critical time, we don't run out of the medications. The projects that were taking place in terms of giving medication to those hard to reach places, I pray that through other supplementary fundings and the rest of it, the ministry can still strengthen that. And we thank the ministry, of course, for increasing the access to, to make sure that HIV services are integrated into the routine care of NCDs and the rest of it. But still, there is a lot of workload posed onto the health systems because of that. And I think they should work tirelessly hard to make sure that this one has been sorted. To the media and then to other developmental partners, HIV is still a very big challenge. So we need to make sure we pass the right information to people. We need to make sure that we look for developmental partners who are still willing to fund the gaps which are in HIV care. And lastly, we still don't have a cure. So your life is very important. Make sure that you guide it so that you don't get this infection. Thank you very much.
Thank you so much, Doctor. That is Dr. Dan Oribalangoya. Thank you so much for your thoughts, for your knowledge, for your wisdom, and for making time to join the conversation today. Dr. Musinguzi Nicholas Jr., thank you so much for making time and indeed for sharing with us your knowledge, your expertise, and opinions about this particular subject here today. And good luck, Ronald Musinguzi. Thank you so much for making time to the conversation and indeed for sharing with us your experiences and indeed what you think can be done to change course in this very, very dangerous situation that we are in as a country. And to you, our viewers, thank you so much for keeping it Community Voices Uganda and Civic Space TV. Special thanks to the technical team and special thanks to the Center for Constitutional Governance and all our partners that made sure this is possible today and going forward. And from I say good evening and may we all be healthy. And like doctors have told us here, let us be safe. Let us focus on the preventive because the curative is not yet there. And certainly we shall live and tell the stories to our grandchildren and great grandchildren going forward. Thank you so much. And I wish you all the best.